It's an enormous privilege to be invited to speak to you here at OUH. So thank you, John, very much, and Jonathan. I want to explore with you two questions, and they are hugely challenging. How can we deliver care for the people of the communities that we serve? And that is an enormous question, and I think it's about how can we ensure that we're creating the conditions for the 1.5 million people that OUH serves, that ensures that they're able to live their lives to the fullest possible extent, to have fulfilling, thriving experiences of life for young children, for young people, to live their lives in a way that's flourishing, thriving, fulfilling. I think that's what our health and care systems must be focused on. And the second question is, how can we ensure that in the process of doing that, those who deliver care themselves thrive and flourish? That makes sense, those two questions? You've come to the right meeting? Yeah. So what strikes me as being most significant about our current NHS is that we are profoundly damaging the health and well-being of all of those who we ask to deliver care for those in our communities. 1 in 20 of our national workforce in this country, in England, work in the NHS. And if you take social care as well, we're talking about 1 in 10. We know that 50% more people in the NHS report debilitating levels of work stress compared with the general working population as a whole. 50% more. And we know that the stress that people experience working in the NHS is not simply episodic, now and again things are a bit stressful. It is chronic. So when we take repeated measures of people's experience of stress at work in the NHS, it's clear that it's chronic. It goes on and on. And what we know about chronic stress is that it is profoundly damaging to people's health. It's associated with dramatically higher levels of cardiovascular disorder, of addictions, of diabetes, of chronic depression, even of family breakup. And we know that every year something like 37% of staff, 38% of staff report that they've been unwell as a result of work stress during the previous year. Here in OUH, in the survey last year, it was 42%, so above the national average. So what we see is that we've created the conditions where those we're asking to be responsible for promoting health and well-being in our communities are being damaged in terms of their health and well-being by the conditions that we've created. That cannot be right, can it? Do you agree? It can't be right. We're talking about 1.5 million people. If we talk about social care as well, we're talking about 3 to 4 million people being profoundly damaged in the process of delivering health and care within a context whose stated mission is to promote health and well-being. And we know that it has an impact on care quality. So we know that when people are working under stress, that they are more likely to make errors that can harm patients. They're less able to be compassionate in their interactions with those that they care for, and indeed with other members of staff. And in the acute sector, we know that it's associated with significantly higher levels of patient mortality. So the question is, what are we to do? And as Jonathan said, I think there is now a national recognition that we're facing an emergency, a crisis, probably the biggest crisis in the history of the NHS. We have 100,000 staff vacancies. That's 1 in 10 of the workforce. That has a huge impact on you who are left. And in social care, it's probably 1 in 9. And that has a huge impact on you working in the NHS as well. So there's a recognition, I think, at national level that there is a crisis. And that's why all of the national bodies and many other stakeholders and institutions have come together to develop a new people plan. And the intent is really important. The issue is, how do we do this? And I think that that's the key question we need to address. What are we going to do about this? How do we make progress in changing this situation? And I think when we're faced with really great complexity in any area of life, it's really important to step back, to stop, to step back and reflect and say, fundamentally, what is this about? What are we trying to achieve here? And when we created the National Health Service, the welfare state in 1948, it was a decision taken by our country, by a post-war society, deeply traumatized, to say we want to care for everybody in our society, regardless of their status, their wealth, their demographic background, their prestige. We want to care for everybody. And I'm acutely aware of how important a decision that was. My mum was, she's 93 now, when she was 9 years old, her father suddenly died and her mother was left with 5 children and no income. So they lost the house. My mother, who grew up in Llansamlet in South Wales, was sent up to an orphanage in London, where from which she absconded after 3 years. But anyway, she tells me that at that time they couldn't even conceive of going to visit the GP because it cost 2 and 6pence and they simply didn't have any money. And all of that changed in 1948 because we decided we wanted to be a society that cared for everybody. We wanted to be compassionate. And we've been fiercely protective of the NHS as a, if you like, an emblem of compassion in our society ever since. And all of you, and those you work with, have made a decision to dedicate an enormous part of your lives, your unique lives, your precious, mysterious lives, for caring for those in your communities. So you too, I think, embody a core work value of compassion. So I think compassion is the core value of the NHS. Compassion and inclusion. Compassion's about including everybody. So what is compassion? Compassion for me is the healthcare assistant I saw who sat holding the hand of an elderly lady in distress and just talking to her lovingly and caringly until she was calm again. The GP from Southwark who told me she'd danced in her surgery that day with an elderly, lonely man when she discovered they had a shared interest in dancing. Beautiful. I had dinner with her recently. She told me he keeps coming back for more dancing lessons. Anyway. But compassion has four behavioural components to it. What's your name?
Fiona.
Fiona. So if Fiona here, if you're in distress, this is quite safe, Fiona, by the way. Yeah. So if you're in distress, then for me to be compassionate, first of all, I have to be present with you. I have to pay attention to you. Nancy Klein uses a lovely phrase, listening with fascination. So I have to listen with fascination to you. And second, I have to have an understanding of the causes of your distress. And ideally, we do that through a dialogue, through a conversation, rather than me imposing my understanding. And third is I have to have an empathic response. I have to feel we talk about compassion, it's about the feeling as well. I have to feel your distress without being overwhelmed by it, because that gives me the motivation for the fourth part of compassion, which is helping you or serving you. Asking, how can I help? How can I serve you? Make sense? So you've got attending, understanding, empathizing, and then helping. And we know that when staff are able to be compassionate in their interactions with patients, that has an enormous impact on patient satisfaction and actually care outcomes. And in turn, that has an impact on the well-being and the commitment of staff. If I feel I'm making a difference and the patient or service user is feeling cared for, then it has an impact on my motivation and commitment. So we get virtuous cycles of compassion. And we know, in fact, that when staff are able to be compassionate in their interactions, it has an impact on staff well-being as well. So And compassion's about blurring the boundaries between self and other. So the challenge for us is, how do we create the conditions in our healthcare and social care organisations where staff can deliver the compassionate, high-quality care they want to deliver? 99.9% of NHS staff coming to work wanting to deliver high-quality, compassionate care for their fellow human beings. That's what's motivated your life choices, your career choices. How do we create those conditions? And the answer to that is, well, it's about the culture of the organisation. Another kind of rather nebulous term, what's culture? Culture's the way we do things around here. Or as somebody said to me recently, a better definition is, culture's the way we do things around here when no one's looking. It's a good definition, eh? I was reflecting that I do the washing up much better when my wife is in the kitchen than when she's not. Do you know what I mean? So it's, culture's the way we do things around here. Well, how do we shape the culture? Well, every interaction by every one of us every day shapes the culture of our organisation. How warm we are, how optimistic we are, how humorous we are, how irritable we are, how cynical we are, how compassionate we are. Every interaction by every one of us every day shapes or nurtures the culture of our organisations, and actually also shapes and nurtures who we are too. But the role of leaders is particularly powerful, because what leaders pay attention to and talk about and monitor and reward and model in their behaviours tells us what it is that they value. Not what the bunch of words on the website are about values, but in practice, what our leaders value. So in order to create compassionate cultures, it's really important, therefore, that leaders model compassion in the way that they lead. And what that means in practice is leaders who pay attention to those they lead. One of the complaints I hear from NHS staff very often is, we only see our leaders when something goes wrong. So it's leaders who really listen with fascination, leaders who seek to understand the challenges that staff face, not imposing their understanding, but really have the courage to try to understand what the staff perspective is, especially when that disagrees with my perspective as a leader, especially then, so that we achieve a shared understanding. Leaders who empathise, who feel for those they lead. I hear continually stories from nurses who say, it was so busy again on this shift, I just couldn't find time even to go to the toilet. There was no time to stop and get a drink of water. I hear from, at the minute I'm involved in an inquiry into the mental health of doctors in this country, and we hear stories of doctors being so tired at the end of shifts that they're afraid to drive home. But there's nowhere to lie down so they can get some sleep. So they drive to the first service station and sleep there. So empathy from leaders is fundamentally important. And the fourth is the real importance of leaders not just listening, but saying, well, how can I help? Thinking, how can I help? Because the other complaint I hear from staff is, they say, our senior leaders are really good. They come around and talk to us and listen to us, and they're very warm and very empathic, and then they go away and nothing changes. The most important skill of a leader is listening. The most important skill of a leader is listening. Listening with fascination. And the most important task of a leader is helping those we lead, enabling them to do the job that they want to do. So these four behaviours are critical, and they're not easy. You know, it's not as though listening with fascination is easy. Oh, I'm too busy to listen to staff. I've got these meetings to attend. I've got these papers to review. I've got to get ready for the next meeting. Listening is the most important task of a skill of a leader. And it's also, does that make sense? Make sense to you? And actually, I think these behaviours are important in our interactions with each other as well. That we listen, we understand, we empathise, and we help. It's at the basis of human relationships. And the research evidence on leadership reinforces the fundamental importance of these four behaviours. I think the other thing that's really important if we're to make progress in transforming the cultures of our organisations, and we have to, this is a crisis, is we have to understand what it is to be human in the workplace. And we know what the core needs of human beings in the workplace are. There are 3 core needs that people have in the workplace. Just think for a minute about what those 3 core needs might be. What is it we need in the workplace? And the research evidence tells us that the 3 important needs are firstly the need to belong. I need to be part of a team that I feel values me, where people support me, where people like me, where people are kind to me, where I feel loved within my team. I need to be part of an organisation where I feel valued, where I feel respected, where I feel supported in the organisation, where I feel my values are consistent with those of the organisation. My values are about, in my work, are around providing high quality, compassionate care. Is that the core value of my organisation as well? When it is, my motivation, my commitment will be high. But if I feel that my organisation's core values are different, meeting the needs of the regulators, cost effectiveness rather than quality of patient care, it makes me feel like I don't belong. We have clear evidence of this. And the second is the importance of a sense of competence and effectiveness in our work. We need to feel that we're making a positive difference, that we're doing work to the quality that we feel we should be doing the work. And one of the major problems is workload. When people have excessive workload, they often go home at the end of the day in the NHS feeling, I didn't provide the quality of care I felt I should be providing. And that corrodes people's sense of motivation and well-being. And the third is the importance of control or autonomy. I feel that I'm not just being forced to do things, that I have choice about how to do the work most effectively. And autonomy is not about being independent from others. It's about free will to do the job in the best way that I feel I can do it, that I'm not being forced, that I have choice. All 3 of these must be fulfilled for people to be well and for people to be motivated at work. It's no good just having 2 that are strong and 1 weak and saying, oh, I'll average it out. All 3 must be present. Probably the research evidence tells us the most important is the third, is the need for control. And why that is significant is because what we see in the NHS is that it is characterised by command and control cultures, which erode the sense of people's individual control and autonomy. Which seems to me an incredible paradox. Here we have the most motivated workforce, probably most motivated and skilled workforce, probably anywhere in industry, and we're managing them through command and control, through hierarchy, through bureaucracy. Makes no sense. It just makes no sense at all. And you know, what we know is that when these needs are met in the workplace, that it has a significant impact on care quality and on patient satisfaction and well-being. Take patient satisfaction, for example. You know, the #1 predictor of patient satisfaction is workload. The higher the workload, the lower the levels of patient satisfaction. And interestingly, so workload's about control and about competence, and the second predictor is equal opportunities, and the third is discrimination. Because when people are excluded for whatever reason within an organisation, they don't feel they belong. And that erodes compassion, and it therefore erodes quality of care and compassionate interactions. And the fourth is teamworking. The importance of being part of a team that's effective as a predictor of patient satisfaction. So, John mentioned the work that you're doing in OUH around culture, and it's based on a very big program of work we undertook a couple of years ago, looking at what were the characteristics of cultures of high quality care in the NHS across England. And what we determined from that research was that 5 elements, if you like, have to be present in cultures, in NHS organisations to ensure high quality, continually improving and compassionate care. And they are depicted there. I'll say a little bit about all 5 of them, but the point of this is if we know that these cultural elements are what's important, then we as leaders, and I believe everybody working in the NHS is a leader, we as leaders must ensure that these are present within our organisations. Leadership is about ensuring direction, alignment and commitment. And the first three are about direction, alignment and commitment. The first one is about vision. It's about, we need to ensure that our organisations are really clear about what their core purpose is. So the core purpose of this organisation, it seems to me, should be about delivering and developing excellence in patient care within a culture of compassion and integrity. I would get rid of all of the other words. Too many words. Delivering excellence in patient care in a culture of compassion and integrity. That's enough. And the point about vision is that it tells everybody in the organisation what we're here for, about being really clear and giving people a sense of identity and value within their organisation. This is what the organisation's about. This is what I'm here to do. It chimes with my values and what I care about. And it can't just be a bunch of words on the website. So we know one of the kind of really exciting things we get to do as researchers in this big study was we wanted to answer the question, what do board members talk about? What do they talk about in those meetings? So we analysed the board minutes of 70 trusts over an 18-month period of their meetings. 80,000 pages of the most exhilarating material you can imagine. Jonathan is actually 22, but all of that board meeting stuff has aged him prematurely. And we found that often what board members in some organisations were doing was spending far more of their time talking about financial performance, the visits of the regulators, cost effectiveness, than they were about quality of patient care. And where that was the case, and there was a discrepancy between what the vision was on the website and what they were talking about in practice, in those organisations, staff were less committed, less trusting of their leaders, less engaged. It trickles down. The messages trickle down, what we care about. So the vision has to be like an anchor for leaders every day. This is what we're here for. Now we can get caught up in the meetings and the initiatives and the bits of paper. This is what we're here to be thinking about and talking about and focusing on every day. What leaders focus on, what they pay attention to, what they talk about, what they monitor, what they reward, what they model in their behaviours, tells staff what it is that they value, and that tells staff what it is they should value, that their leaders require them to value. And the second factor that's really important is we have to translate this vision into clear objectives at every level. Because what's characteristic of the NHS is people are overloaded. There are so many, we see so many initiatives and priorities. In our research team, we came to call them the priority thickets. In NHS organisations, there were so many priorities that no one could see what was important anymore. And staff would say, there are all these initiatives, all these bits of paper, look, we just try to keep our head down and get on and deliver patient care. And minimise the amount of attention that we give to all that, because it takes us away from what's important. So it's really important that from the top team down, and I know your executive team have clarified their objectives, that every team, whether it's a ward team at the beginning of a shift, that every team is clear about what its core 5 or 6 objectives are. One of those objectives, by the way, for every team in this organisation should always be improving the effectiveness with which we work with other teams in the organisation, or indeed outside the organisation, to deliver care for people in our community. So it's really important that for every team and every individual and every department and every ward, there are 5 or 6 clear, challenging objectives aligned to the vision of the organisation. And here's some examples of the kinds of areas where we might have objectives. It's not prescriptive, it's just to give examples. But this is axiomatic. We know that from all of the work we've done on teams and international research on team working in healthcare, the most important determinant of team or department or individual performance in work is having agreed, not imposed, a limited number of clear, challenging objectives. It's kind of boring and a bit banal, but it's what predicts motivation and performance and team performance in the workplace. And it ensures that people are much less stressed because they're not overwhelmed with 10, 15, 20 different priorities and objectives and wondering where to give priority attention to. This is evidence-based practice. Make sense? So it's really important that we establish a discipline of clarifying our objectives at every level within the organization. This is fundamental. And as I say, it's also associated with much lower levels of work stress. And we also have to make sure that we are not just agreeing objectives, agreed, not imposed, but making sure we're giving people feedback. All this data which is collected in the NHS, we see nurses entering the same data on 3 different forms at their workstations. And then the data goes off, the papers go off and disappear in some pink poodle parlour in the sky, never to be seen again. What are we collecting data for if we're not using it to give feedback to staff and teams about how well they're doing, helping them to improve performance? So we have to create feedback-rich environments for people. This is the basics of performance management. Our appraisal systems, looking at your data on appraisal, 1/3 of people say in their appraisal conversation, only 1/3 say that their appraisal conversation helped clarify objectives for their work. Only 1/3 say that they felt they could do their job better as a result of the appraisal conversation. Only 1/3 said that they felt more valued and respected and supported by the organization as a result of the appraisal. Well, if the appraisal's not doing those things, what is it being used for? Somebody just ticking a box somewhere and say, well, we had the conversation. What a waste of time for 2/3 of the staff in the organization. And appraisal, of course, once a year, important conversation, but it should be a daily, weekly process of support by leaders and supervisors and team members to help us do our jobs more effectively, to help us share problems, to help us get the support. And the third is the importance of creating commitment in our organizations, and that's about leadership. And we reviewed all of the research on leadership a few years ago and published a paper with the Faculty of Medical Leadership of Management and King's Fund and Centre for Creative Leadership. We looked at all of the research on leadership and also in healthcare. And what that tells us is that to be effective, leaders must be authentic, genuine people in the way they behave, not putting on some mask when they come into work. Leaders must be open and honest. And we need leaders who show humility. The humility, not to be eager to please everybody all the time, but the humility to say, how can I be better as a leader? How can I help you more effectively? What do I do which gets in the way? What do you need me to do more of? Because we know that narcissism and pride and hubris are terrible qualities in a leader. Interestingly, the extent of narcissism in the general population as a personality characteristic is about 1%. Among senior leaders, it's about 6%. Be careful. It's 100% in the current American presidency. So it's a very dangerous characteristic in a leader. And we need leaders to be optimistic and compassionate and appreciative. The single biggest, most frequent complaint I hear from NHS staff is, apart from service users and patients, no one ever comes and says thank you to us. That's tragic. And I think it's partly because we know that we humans consistently underestimate the power of our expressions of gratitude and appreciation on other people. We consistently underestimate that, but it costs nothing, and the ripples spread out. I've been hearing tragic stories from nurses and doctors about the stress and pressure that they're under. And then somebody says, yeah, but there was a moment last week where one of my colleagues came and said thank you and said what a great job I'd been doing, and it just changed the whole day for me. Or my colleague came up and said, look, it looks like you're having a really hard time, have a cup of tea. And how that transforms the day for people. And I want to assure you that what I'm saying is not simply ideology. We've got, 15 years of data now from the staff survey. 250,000 people every year. It's the most amazing data set in the world in terms of understanding organizational performance. And what we know from that data set very clearly is that there is no better predictor of trust performance. All the data that's collected in the NHS, there is no better predictor, nothing comes close to staff experience as a predictor of how well trusts subsequently perform. So when staff say there's high work pressure, patients say there are too few nurses, I wasn't treated with the respect or given the privacy or treated with the dignity that I wanted. When staff report poor health and well-being, and remember what I said at the beginning, when staff report poor health and well-being, subsequently we see that those organisations have significantly worse care quality, significantly worse financial performance, lower levels of patient satisfaction, and in the acute sector, higher levels of patient mortality. The evidence is clear that staff experience is fundamental to the delivery of high quality care. There is no more important issue to focus on. And the most significant predictor is levels of staff engagement. It's kind of the opposite of levels of staff stress. So the more engaged staff are, the better do our organisations perform. Better care quality, better financial performance. There's a direct link between staff engagement and financial performance of our organisations. So how do we create the conditions where staff are engaged? Well, it's about meeting their needs to belong, it's about meeting their needs for competence and efficacy, and it's about meeting their needs for control. And we are able, from the staff survey data, to identify those trusts which have been really successful in raising levels of staff engagement and then maintaining them at a high level. And we see that there are 5 core characteristics of those organisations. They have stable senior leadership, they've got a clear vision, they've retrained their leaders to adopt more participative, supportive, compassionate leadership styles. They have got rid of hierarchy largely, not completely of course, but they've devolved responsibility down to frontline staff to make their own decisions about improving care quality within safe boundaries. They've trained people in quality improvement across the whole organisation, but most importantly, they're organisations where staff feel that it's fair, that they trust their leaders, that they feel that there isn't bullying and harassment, where minority groups don't feel discriminated against. You know, probably the most important barometer of morale we see in NHS organisations is levels of discrimination. So the higher the levels of discrimination, the lower the levels of trust, and that has a huge impact then on care quality. And the fact is that across our NHS organisations, that there are very few that we can hold up as models in terms of treating people from minority groups in a fair, open way in terms of equal opportunities. I showed you the data on patient satisfaction. So it's a huge job for us in creating cultures of trust and fairness and openness within our organisations, particularly in relation to how minority groups are treated. And you know that the irony is the group of staff who report the highest levels of discrimination in the NHS are people with disabilities, staff with disabilities. God forbid you should be a black Muslim woman with a disability working in the NHS. We have to address this issue. A couple of years ago, I went to Wrightington, Wigan and Lee, which is an NHS trust in the northwest that's been very successful in raising levels of staff engagement. And I went to their engagement committee meeting, which was a bunch of fun, and they kept talking about the horse. So I asked, well, what's this about horse? And they told me the story of Sheila Marsh, who was a lady sadly dying in the palliative care ward. And she had just a few hours left to live. And one of the nurses said, what might make you happy? And she said, well, I'd just love to see Bronwyn again. Bronwyn, it turned out, was a horse she'd raised over a 25-year period because she worked at Haydock Park Racecourse. And so the nurses got into a huddle, called the family and said, can you bring Bronwyn into the hospital? So they arranged for a horse box, brought the horse in, and they took Sheila Marsh out on her bed. And the horse clearly recognized her and nuzzled her and kissed her, and it was a really moving moment. And I don't know if you can really see Sheila Marsh's face, but she's really smiling and clearly happy. She sadly died a few hours later, but it was a really wonderful moment. She was full of joy at seeing the horse. And her family were incredibly moved and grateful for the staff for organising this. And it was really affirming and moving for the staff as well. Nobody called health and safety. Because there was a culture of engagement and compassion, staff did the right thing and they knew they would be supported. And that's the challenge for us, is how we create a culture of compassion and engagement where staff will do the right thing and know they'll be supported. A few weeks ago, I did a webinar with Prerna Issa, who's the new Chief People Officer for the NHS, a wonderfully inspiring leader to have joined the NHS from the World Food Programme. And with Don Berwick, who formed the Institute for Healthcare Improvement. Don Berwick said we should have just one manual for all NHS staff with one page in it that says one thing: do what you know to be the right thing. It's enough. Do what you know to be the right thing. And we also know that creating commitments about the culture that we create in terms of the emotional environment. We human beings are primarily emotional creatures. We kind of think of ourselves as cognitive, intelligent. We're primarily emotional, and the emotional environment we create in the workplace is critical to performance. The more positive we feel, the more compassionate we are, the more positive we feel, the better decisions we make, the more positive we feel, the more creative we are. You know, if you've got positive leaders of teams, those teams are more cooperative, more compassionate, more effective. There's amazingly been a randomized controlled trial of positive emotion and diagnosis accuracy in doctors. So if any doctors in here? Any doctors, raise your hand. Do you like chocolate? You do like chocolate, yeah. So if you induce positive, what's your name? Claire. So if you induce positive emotion in Claire by giving her a bar of chocolate, the randomized controlled trial shows she makes better medical diagnoses. So you're going to have a hell of a lot of chocolate next week, I can tell you. All these people bringing in chocolate for you. Incredible, eh? The more positive we feel, the less likely we are to, if we're exposed to the cold virus, the less likely we are to develop a cold virus. Actually, another quick experiment I read recently, they were looking at, they called people every day at the end of the day to ask them about their days. And one of the things they asked, how many hugs did you have today? And then after 2 weeks, they brought these people in, put them in a confined location and exposed them to the common cold virus. They found that the number of hugs they'd had in the previous 14 days accounted for 37% of the variance in whether or not they got a cold. Hashtag no colds here. You know, you see the point. This is not about leaders coming in on a Monday morning, you know, adopting some kind of Ken Dodd persona, God forbid. It's about leaders who are authentic and open, have humility and are optimistic and appreciative and compassionate, so that we create those emotional environments. But it's also about recognizing the negative emotions in healthcare. You know, being in a location when a neonate has just died in intensive care and it's devastating for staff, or in a mental health organisation when the news comes in that a service user has taken her own life. It's devastating, and we have to acknowledge and validate and hold people's negative emotions in this really difficult workplace. And I know that you've introduced John Schwartz Frans into the organisation. Introducing. Are you all familiar with Schwartz Frans? Wait, go like this if not. Okay, so Schwartz Frans is an idea developed in the US by a surgeon who was dying of cancer, who discovered that actually in his own care it was about the emotional interactions, the caring interactions. That's what made all of the difference. And so it was the idea of bringing groups of staff together with lunch, it's critical, and asking people to share their emotional experiences around a particular event. It could be a patient interaction or whatever. Not with the purpose of problem solving, but just sharing. And the results of research in this country have shown it has a dramatic impact on staff stress and well-being, reducing levels of staff stress just by taking the time to share, to acknowledge the difficult experiences we have during the course of our days. And it's also about making sure that we're dealing with the unacceptable behaviours in our organisations. If we don't deal with the intimidating behaviours, the aggressive behaviours of individuals, then it will corrode all of our attempts to create compassionate, supportive cultures which we know will deliver high quality care. So we have to have the determination and the courage and the compassion to deal with those behaviours in our organisation which undermine the culture, aggressive, intimidating behaviours or chronic poor performance. And I know that efforts are underway within the Trust to make sure that we're developing cultures where those behaviours are identified, addressed, and compassionately dealt with. And the fourth is the importance of having cultures of innovation. See, I think the only way we're going to be able to deliver high quality care for the people we serve is to develop innovative ways of dealing with the challenges we face. Workload is an incredibly challenging issue. We can't go on loading more and more work onto staff who are already beyond breaking point in many instances and expect them to cope. It's not sustainable. We have to address the issues of workload through task reallocation. Do you know, getting rid of unnecessary work. East London Foundation Trust has cut out 85% of its clinical audit activities. 85% of its clinical audit activities. Care quality's gone up. They had an exercise where they asked staff, what rules would you get rid of in the organisation? So they had hundreds of responses, and it turned out that 1 in 3 of those responses weren't rules at all. They were just rules people thought were rules. They got rid, for example, of needing a supervisor's signature for training, mandatory training, or elective training. So it's also about getting rid of unnecessary activities. But what we know about innovation is it's most likely to occur, from the review of all of the research on innovation we've undertaken, it's most likely to occur when people have leaders who display those 4 behaviours: listening, understanding, empathizing, and helping. Because where you've got leaders who are compassionate, that reinforces the intrinsic motivation and fundamental altruism of healthcare staff. And compassionate leaders create what my colleague in Harvard, Amy Edmondson, calls psychological safety. People feel safe to talk up about errors. They feel safe to talk up about, I feel that I'm out of my depth here. They feel safe to say, the workload's too great, I'm terrified I'm going to make a mistake. They feel safe to say, I feel I'm being bullied. When you have compassionate leadership, people will identify issues and problems, and that's the beginning of the innovation process. So it's fundamental to innovation as well. But we also know that what's critical to innovation is autonomy and freedom and control. The more hierarchy in an organization, the more bureaucracy, the less likely people are to innovate. So we have to create what we've called conditions for collective leadership, where everyone feels they have leadership responsibility, where there's shared leadership in teams, where leaders are working together across boundaries to prioritize patient care, and where there's a consistent approach to leadership characterized by authenticity, by openness, by humility, by compassion, by optimism, and by appreciation. And the 5th area is the importance of team working. Team working is really poorly developed in the NHS, and I think it's really, really important, the work that OUH is doing around developing effective team working using the Athena team journey and the Athena coach program, because the evidence we have is that team working is probably one of the 3 or 4 interventions that will make the most powerful difference to healthcare. We know that in the NHS, 96% of people say they work in a team. And then we say, does your team have shared objectives, clear shared objectives? Do you meet regularly to review your performance? Then the figure drops to 40%. Got 40% of people then we think working in something like a real team and about 60% in a pseudo team. We know what basically real team working looks like. It's these characteristics. I'm not going to go through them. But we also know that the more people working in a pseudo team, we think that's 60% of people in the NHS, the higher the levels of errors, the higher the levels of stress, the higher the levels of injury, and the higher the levels of patient mortality. We estimate, at the most conservative estimate, that if we could increase the percentage of staff in the acute sector working in teams with clear objectives and that meet regularly to review performance, that would be associated with the prevention of 5,000 avoidable patient deaths annually in England, at a minimum. Team working is not just a nice to have, it's critical to the effectiveness of our organisations. The other thing about team working is we have to stop working. Stop spinning the hamster wheel. Teams are under such pressure. And we began a program of research in 1990 saying, well, what happens if teams under pressure stop and take time out? And all of our research and many others around the world has shown that teams that do that whether it's a ward shift at the beginning of a shift saying, what's our focus today? At the end of a shift saying, what did we expect to happen? What did happen? What didn't happen? What can we learn from this? Teams that do that are far more productive and effective. A recent meta-analysis where you combine the data from many different studies, in this case it was 49 separate published peer-reviewed studies, showed that teams that took time out on a regular basis to reflect and review were on average 38% more productive. 38% more productive. Stopping and reflecting and reviewing is not something we should encourage teams to do. It's something we should insist that teams do. Fundamental. So we need, do you know what I mean? Doesn't that sum up a lot of the NHS? You know. So we need to develop great team leadership. I'm not going to go through all of this. Interpersonal relationships in teams are fundamental. We've got to be kind and warm to each other. We don't have to be bosom buddies, but we must never let interpersonal differences get in the way of our professionalism. Interpersonal conflict, chronic interpersonal conflicts in teams is a disaster. So it's vital that we ensure good relationships, supportive, warm, positive relationships. We all fall out from time to time. It's the chronic stuff that's a problem. And it's about ensuring inter-team cooperation, asking the question, how can we be more helpful to you? What do we need to do to help? How can we make a difference? I'm not going to go through all this. My mother says that's an amazing book if you want to learn more about team working. But anyway, it's how we bring about, how we change cultures. And as Jonathan mentioned, OUH is going through the Culture Change Programme, which we've developed with the Centre for Creative Leadership and the King's Fund and NHS Improvement. We launched it 2 years ago. There are 80 trusts in England going through it, working together, and there are trusts in many other organisations in many other countries as well. We designed it to be evidence-based, open source. You don't need to bring in expensive external consultants to do this. It's managed by the change team as you're doing within the organisation. It's that three-stage process of what's our existing culture and leadership. Let's design a strategy to change it, and then let's implement it. And you've completed the first phase, and I think the work that you've done is just exemplary. I think it's a model for other organisations in how effectively and intensively and comprehensively you've done that. So I recommend to you continuing with that work, which is owned by OUH and designed by OUH. But I want to finish by just going back to what I said at the beginning. We have to look after ourselves. And we know about human well-being, and we know that the most important factor by far and away, in terms of your well-being, is spending time, quality time with people we love and who love us. Nothing else comes close. If you're working 70-hour shifts and you're going home exhausted every week, you don't have the capacity to spend quality time with people you love and who love you. And that's the most important factor by far and away for human well-being. Along with that is things like exercise, as you know, sleep. They've done a lot of research on sleep recently. Guess what they've discovered? It's actually important. Who'd have thought? 7.5 to 8 hours a night. If you're getting by on 6 hours sleep a night, you're 190% more likely to develop hypertension, 110% more likely to develop chronic depression, 67% more likely to develop diabetes. Sleep is important, especially the last hour or two. And continuing to learn and grow, and being in the here and now, seeing the beauty of nature at this time of year, seeing the faces of our loved ones, being present, and helping others. And we have the privilege of working in a context, a sector, where our work is about helping other people. So the more we can spend our time providing high-quality, compassionate care, rather than doing things we feel are unimportant, the better that is for our well-being. But I think fundamentally I want to leave you with the message about compassionate leadership. If the 1.5 million people who use OUH services come and receive compassionate care, they take that compassion back out into their families and their communities. If the 1.5 million people who work in the NHS, or 3 million if you take health and social care, encounter compassionate cultures and leadership in their daily work lives, then they too take that back out into their families and communities. The potential force for good of our health and care system in our society is just enormous, and at a time when we desperately need it as a country. Never in my lifetime have we needed it more. So it's about your compassion and your leadership. But for you to have the resilience and the capability and the capacity to be compassionate, then I think first we have to be self-compassionate. We have to pay attention to ourselves. We have to understand the challenges we face in our work and in our lives generally. We have to empathize with ourselves, to care for ourselves, and then take action to help ourselves in order that we can be the best we can be, our best selves, and stay close to the core values that give our lives meaning, like compassion. And that enables us then to have deeper and more authentic connections with all of those we lead, and in fact with everybody we interact with. So it begins with self-compassion. So thank you very much for listening to me. Thank you very much. Thank you.